Hi, I'm Colin. I'm an account strategy director here at Coegi. I work on our healthcare and pharmaceutical clients, formulating digital strategy for brands, and here to talk about insights on how to leverage digital media to improve results. When it comes to targeting for healthcare and pharma brands, first starting off with a patient audience, one of the more premium tactics and forms of targeting is still the endemic placement. Given how and when you're reaching that person, whether they're going online and they're looking up, contextually relevant information in regards to a disease condition, it offers a great way to catch them in the right moment and also still compliant as well. However, there's still challenges. There's still pieces that are missing from the contextual placement is its inability to scale. There's only so much inventory around health, around a particular condition to reach that user, which a great complement to the contextual placement is the ability to use a lookalike audience. And that's even outside of healthcare and pharma targeting, just knowing it's a great way to balance the ability to stay targeted at scale and just kind of shows the relationship between those two forms of targeting. And it's really on the advertiser to, in regards to those placements, to find the right content, to put together the most meaningful model when it comes to a lookalike audience built off first-party data, built off the correct audience to mock, to really provide value and performance for brands. In speaking to the cookieless future and what that means for healthcare and pharma, knowing that healthcare and pharma is already a regulated vertical, I think adding the cookieless future piece is important, but also I feel like advertisers have picked up a practice that has already taken the cookieless future into account. Understanding that the contextual is going to be a big leaning point, not just for healthcare and pharma, but because that's what it means for the cookieless future. Pharma has kind of already adapted the contextual piece to be a pretty pivotal pillar piece in terms of targeting. I think it's going to also move healthcare and pharma advertisers to really break the mold of the traditional channels and move into ones that have more adopted the ability to live without the cookie. Example of those channels being video, right? Connected TV, in which I feel like pharma has healthcare and pharma has started to move into, but really kind of push the boundaries to get brands and advertisers to challenge those different channels. And going back to point of care as well. Point of care is a channel in which advertisers do not need that cookie to be able to reach a patient audience. So circling back, it's one of the weird and only opportunities I'll say that healthcare and pharma might actually be above the curve when it comes to marketing. Is truly they have pieces already in place for advertisers to live without that cookie. When targeting a healthcare provider, when it comes to digital media, knowing it is less restrictive when compared to the patient audience, there's a lot at an advertiser's fingertips in a way to reach that HCP. And I think where it is on the advertisers is understanding what is that right mix. And I've seen kind of a buzzword in our industry with MPI targeting and just kind of leaning into that form. It's truly on the advertiser to understand, well, what does that mean? And analyzing the brand's needs, understanding their scenario, their challenge. What are the right tactics to bring to the table? It's not just taking a brand's list and uploading and reaching, set HCPs in that list. It's what are we really trying to do at the end of the day? Is it possible to target by diagnosis code and reach multiple different kinds of HCPs? Is it specifically to just a particular specialty that we're trying to reach? Is a brand trying to generate switch, right? And targeting HCPs who are writing competitor scripts. So there's so many different opportunities when it comes to targeting that HCP. It is on the advertiser to sit down with the brand and have a conversation to understand what is the right mix to really influence media targeting that's going to work.